Assalamu alaikum. Today we will discuss about fever. Fever, also referred to as pyrexia, is defined as having a temperature above the normal range. Due to an increase the body temperature set point, there is not a single agreed upon upper limit for normal temperature with sources using value between 37.2 and 38.2 degrees Celsius in human. The increase in set point trigger increased muscle contraction and causes a feeling of cold. This result is greater heat production and effect to conserve. When the set point temperature returns to normal, a person feel hot, become flustered, and may begin to sweat. Rarely, a fever may trigger a febrile seizure, with this being more common in young children. Fever do not typically go higher than 41 to 42 degrees Celsius. Fever can be caused by many medical conditions ranging from non-serious to life-threatening. These include viral, bacterial, and parasitic infection such as influenza, common cold, meningitis, urinary tract infection, appendicitis, COVID-19, malaria, etc. Non-infectious causes include vasculitis, deep vein thrombosis, connective tissue disease, side effect of medication, and cancer. It differs from hyperthermia in that hyperthermia is an increase in body temperature over the temperature set point due to either too much heat production or not enough heat loss. Treatment to reduce fever is not generally not required. Treatment of associated pain and inflammation, however, may be useful and help a person rest. Medications such as ibuprofen and paracetamol may help with this as well as low temperature. Measures such as putting a cool damp cloth on the forehead and having a slightly warm bath are not useful and may simply make a person more uncomfortable. Children younger than 3 months require medical attention, as might people with serious medical problems such as compromised immune system or people with other symptoms. Hyperthermia does not require treatment. Fever is one of the most common medical signs. It is part of about 30% of healthcare visits by children and occurs in up to 75% of adults who are seriously sick. While people involved as a defense mechanism, treating fever does not appear to worsen outcomes. Fever is often viewed with greater concern by parents and healthcare personnel. Then is usually deserve a phenomenon known as fever phobia. Associated symptoms. A fever is usually accompanied by sickness behavior which consists of lethargy, depression, loss of appetite, sleepiness, hyperalgesia, and the inability to concentrate. Sleeping with a fever can often cause intense or confusing nightmares, commonly called fever dream. Diagnosis. A range for normal temperature has been found. Central temperatures such as rectal temperature are more accurate than peripheral temperature. Fever is generally agreed to be present if the elevated temperature is caused by a raised set point. Temperature in the anus is at or over 37.5 degree Celsius. An ear or forehead temperature may also be used. Temperature in the mouth is at or over 37.2 degrees Celsius in the morning or over 37.7 degrees Celsius in the afternoon. Temperature under the arm is at or over 37.2 degrees Celsius. Normal body temperature vary depend on many factors including age, sex, time of day, ambient temperature, activity level and more. The rises temperature is not always a fever. For example, a temperature of healthy person rises when they exercise, but this is not considered as a fever. On the other hand, a normal temperature may be a fever if it is usually high for that person. For example, medically frail elderly people have a decreased ability to generate body heat. So a normal temperature may present a clinically significant fever. Hyperthermia. Hyperthermia is an increase in body temperature over the temperature set point due to either too much heat production or not enough heat losses. It is an example of a high temperature phenomenon that is not a fever, rather it occurs from a number of causes, including heat stroke, neuropathic, malignant hyperthermia, as well as in response to stimulants such as cocaine and in idiosyncratic drug reaction. And serotonin syndrome hyperthermia differs from hyperpyrexia. Types of fever. Number 1. Continuous fever, where temperature remains above normal throughout the day and does not fluctuate more than 1 degree Celsius in 24 hours, such as in lobar pneumonia, typhoid, meningitis, urinary tract infection, or typhus. Number 2. Intermittent fever, where the temperature elevation is present only for a certain period, later cycling back to normal, such as malaria, leishmaniasis, paema, or sepsis. Number 3. Remittent fever, where the temperature remains above normal throughout the day and it fluctuated more than 1 degree Celsius in 24 hours, such as in effective endocarditis or brucellosis. Number 4. Quotidian fever, with a 24-hour periodicity, typically of malaria, caused by Plasmodium species. Number 5. Tertian fever, with a 48-hour periodicity, typically of later course malaria caused by Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale. Number 6. Quartan fever, with a 72-hour periodicity, typically of later course malaria caused by Plasmodium malariae. In addition, there is disagreement regarding whether a specific fever pattern is associated with Hodgkin lymphoma and Pelivastin fever. Number 7. Persistent fever that cannot be explained after repeated routine clinical injury is called fever of unknown region. Number 8. Neutropenic fever, also called febrile neutropenia, is a fever in the absence of normal immune system function because of the lack of infection-fighting neutrophils. A bacterial infection can spread rapidly. This fever, therefore, usually considered to require urgent medical attention. This kind of fever is more commonly seen in people receiving immune suppressant chemotherapy than in apparently healthy people. An old term "febrile" has been used to refer a low-grade fever, especially if the cause is unknown, no other symptoms are present, and the patient recovers fully in less than a week. Hyperpyrexia. Hyperpyrexia is an extreme elevation of body temperature which, depending upon the sources, is classified as a core body temperature greater than or equal to 41 to 41.0 degrees Celsius. The range of hyperpyrexia, including cause considered severe and extreme, it differs from hyperthermia in that 1. Thermoregulatory system set point for body temperature is set above normal, then heat is generated to achieve it. In contrast, hyperthermia involves body temperature rising above its set point due to outside factors. The high temperature of hyperpyrexia are considered medical emergencies, as they may indicate a serious underlying condition include permanent brain damage or to death. A common cause of hyperpyrexia is an intracranial hemorrhage. Other causes in emergency include sepsis, Kawasaki syndrome, neuroleptic malignant syndrome, drug overdose, serotonin syndrome, and thyroid storm. Management. Fever does not necessarily need to be treated, and most febrile causes recover without specific medical attention, although it is unpleasant. Fever rarely rises to the dangerous level even if untreated. Damage to the brain generally does not occur until temperature reaches 42 degrees Celsius, and it is rare for an untreated fever to exceed 40.6 degrees Celsius. Treating fever in people with sepsis does not affect outcomes. Conservative management. Limited evidence support sponging or bathing feverish children with tepid water. The use of fan and air conditioning may somewhat reduce the temperature and increase comfort. If the temperature reaches the extremely high level of hyperpyrexia, aggressive cooling is required. The general people are advised to keep adult hydrated. Whether increased fluid intake improves symptoms or shorten respiratory illness such as the common cold is not known. Medication. Medication that lower fever are called antipyretics. The antibiotic ibuprofen is effective in reducing fever in children. It is more effective than paracetamol in children. Ibuprofen and acetaminophen may be safely used together in children with fevers. Ibuprofen is also superior to aspirin in children with fevers. Additionally, aspirin is not recommended in children and young adults due to the risks of Reye's syndrome. Using both paracetamol and ibuprofen at the same time or alternating between the two is more effective at decreased fever than using only paracetamol or ibuprofen. Response or non-response to medication does not predict whether or not a child has a serious illness. Thank you very much. Stay with us. Please subscribe and hit the notification button.